Good evening, everyone, and a warm welcome from Society for Field Medical Affairs, short form as SFM. And for today, I'd like to introduce two of our panelists, one from UK and another one is from India. So today, basically, it is all about how do we master the art of virtual KOL engagement. We have seen COVID since 3 years, and still there are few challenges in how do we manage the interaction from our field medical affairs. So again, welcome you all, and we'll have an exciting discussion here lined up. So let me give you a brief background of the society called SFM. It's a non-profit, non-government organization which is dedicated for the advancement of the field medical affairs in India. And it's a registered society. And this is a platform for budding MSLs and who are new into this role called field medical affairs. And it provides a platform for each one of you to learn and share what's the best practice. And finally, the major outcome is to improve the patient's outcome. So to welcome our first speaker or panelist for today, we have Dr. Dushyant Lal. He is done as MD in pharmacology with over 10 years of experience in medical affairs and currently working as MSL lead for Takeda India. And he's got very rich experience working in this pharmaceutical industry and experienced speaker and very experienced in KOL management. Then we have our foreign guest, special guest here today, Michael Ire, and he's a field manager and responsible currently managing international MSLs across 45 countries for a pharmaceutical company, and he is associated with Amplity Health. And he's also got very rich experience working in major multinational organizations, wherein managing all the phases of clinical trial. And his also background is being immunology scientist. So we got a mixed experience of a clinician and a scientist over here. So good time for us to learn much more from these experienced professionals. So few housekeeping rules. Keep your cameras and microphone off during the entire event. And if you have any questions, please drop them in the chat function, and we can take it up later during the Q&A session. If slides are not visible, please reconnect. And the disclaimer is that we are recording this session, and the recording will be available publicly. Thank you. So I would like to welcome Dushyant to take up and set up the context with this particular topic. Over to you, Dushyant.
Thanks, Nandan. Thanks for setting up the context, and good evening, everyone, and my dear colleague. I hope everyone is doing well. So at the outset, I must thank Society for Field Medical Affairs for giving me this opportunity to present my experience and share my thoughts on this very pertinent subject, the mastering the art of virtual KOL interaction in COVID era. So I would be giving you the Indian perspective, as well as Michael is with us for sharing his global experience, which is very enriching. I can see that 16 MSLs in 45 countries. So he is managing a big team and having a big region responsibility. So would love to hear Michael, and would love to learn from his experience. And also I would compliment and appreciate the thought of the office bearers of SFM for thinking about this subject and coming up with this panel discussion, so that all people who have joined, the budding MSLs and experienced industry colleagues would enrich and would learn more on these important skill sets. So with this, I would request Nandan, can we move to the next slide? So 2020, beginning 2020, early 2020, everything is change. I would say people were working in person from their offices till Feb or March, early March in India. And then suddenly there was a lockdown happened, and there was pandemic, which changed everything. And that change is still getting imbibed and people are embarrassing that change. Every day there is something new to learn, and this pandemic is going to stay with us, and we need to adapt ourselves in terms of getting more and more skilled to meet the challenges and to have some solutions for the problems that we encountered during these 2 years. So I would be sharing my experience on how we managed and how we tried to connect with our KOLs, key opinion leaders, and how we engage with them during these 2 years. Next slide, Nandan. So this is now is a known fact for everyone who is working in medical affairs that pandemic has reduced the access of STPs across globe and across specialties. So previous to 2020, we were meeting them in person. We could have a good in-clinic time. We could discuss on the therapy, and we could generate and capture more and more insights. But suddenly after March 2020, things have changed a lot. We were all in complete lockdown. Doctors were occupied with their clinical priorities, and we were getting very less interactions and insights during this 2020. I would say in 2020 we were in the learning phase. We were trying to come up with the solutions to the problems which this pandemic has came up with. So you can see in this particular slide, all the specialties, across specialties, doctors are now not very keen to meet in person. They are more interested in engaging virtually or remotely, and they would prefer that if medical affairs person or a company personnel, whether sales or commercial or marketing, if they would interact in a virtual manner, and as well as in hybrid manner, then the things would be more better and more impactful for them. Next slide. Now, with 2 years into pandemic, we have learned a lot, and we are now meeting our responsibilities in a very impactful manner. We could able to now engage, interact with the KOLs in a hybrid model, and this, believe me, friends, this thing will going to stay with us. So it's not going to happen that after 1 year or 2 year or 3 years down the lane, this virtual environment and digital settings will suddenly goes off. These will going to stay with us, and now even our external stakeholders, doctors, are also willing to connect with the medical affairs personnel either in person, and also they would like to do it virtually. So that is why this important webinar, or I would say panel discussion, is happening, where we are going to share the important takeaways which can be utilized by MSL or medical affairs person to have a more impactful and efficient discussion with our KOL. Next slide. So the takeaway, important crux till this slide is that virtual world would going to remain with us, and we need to adapt and work in both the settings, virtual as well as in-person setting. So how to work in a virtual world and how to master the art of virtual interaction is something which I am going to now brief in coming slides. Next slide. So this is basically a very hygiene kind of practice which MSL or regional medical advisor should practice and should start doing from the day they join the industry. So they should have pre-interaction planning. So everything which we decide to do, we should plan first. We should have complete understanding on our KOLs and SCPs, to whom we are going to interact, whom we are going to approach or reach out. So this interaction planning would involve understanding on the customer or the KOL, understanding on the therapy area, understanding on the strategic needs of the business. So all these three things would help you to craft a customized interaction call with your KOL. and then this call would be very impactful. If you go in this kind of planning with this kind of background work, then your call would be very impactful, and this impactful call would help you in building more and more rapport and more robust relationship with your KOLs and SCPs. And once the relationship is like of a buddy to them, a scientific buddy to them, I always say that MSL is a scientific buddy to the doctor or KOL. So if they consider you as their one point of contact or scientific buddy, they will definitely like to discuss new data or recent updates in the therapy area or recent updates on the molecules in the therapy area. They would ask, right? They would ask you questions, and they would seeking your support in getting information on certain challenges that they are facing in treating new and new sets of patients. And also after your call, you must analyze what was that call was basically planned for, how that call went, and what was the learning from the call. So the learning, which is one most important learning that you should have in each and every KOL interaction, is you should have some insights. The insights may be on the therapy area, the insights may be on the molecule, the insights may be on the competitor strategy, the insight may be on some patient support program. It could be anything, but if we could able to generate some actionable insights for the strategy, and this strategy can be then modified according to the need gap or the unmet need in the therapy area, then this whole cycle would be complete. So planning and then post-call analysis, insight generation is something which is very important. Next step, next slide, Nandan. Now some important tips for getting into virtual interactions with the KOL. So like we used to go face-to-face meeting, always dress appropriately and always wear formal attire so that it should not give any sort of casual and idea or approach to the KOL. Ensure that the place or the room which you are using for your virtual interaction is conducive for the interaction. It should not that there is multiple background noise coming and your camera is not working properly. So these kind of things you need to have in place. Be very calm, be very composed, and be very confident during the interaction. So these things are very much important if you are interacting with a national KOL or a very high stature KOL. So these people always see that how much confident is the person interacting with them. Do you know science? Do you know that therapy area? So all these things matters a lot, and these all things will give you more and more confidence. And once you have a complete hold on your therapy area, then the confidence will be super high, and you will do justification to the interactions with the KOL. And definitely you will bring some actionable insights out of each and every interaction that you are doing with the KOL. So as I mentioned before, going into call, we should have a plan in place that why I am meeting this doctor, what is my plan of discussion, what scientific agenda I am having, what paper, recent article I need to discuss, or what strategic insights I need to gather by interacting with these KOLs. This should be with you, because it should not be a very impromptu kind of discussion that you started. Or also I would mention here, don't try to have a courtesy call with the doctors that, hello sir, how are you and how is everything going on? I hope you are doing well. So you know that what I am talking about. So be very professional and be very precise that I want to discuss this particular paper, recent article with you, recent updates on the therapy area or recent happenings in the therapy area. So that thing attracts doctor attention or KOL attraction, because KOL always thinks that what is in it for me? Why Dushyant is calling me, or why Dr. X from company is calling me? What is there? Why should I attend the call? Why should I give him my time, which could be of priority for the patient. So we need to be mindful of the time, because that time is very precious for the doctor and his patient. And then, as I mentioned, minimum distractions. I know that we are in virtual settings, technical glitch may happen, but try to minimize it as far as possible. When you are not speaking, like currently in this setting, I am very impressed that we are all people who are not speaking are on mute. So uh, uh, follow this practice and use this practice in your virtual KOL interactions also. And last but not the least, whatever you are discussing, if you are getting some important key messages from the KOLs, do jot it down, and then after the call, that analysis thing needs to be happen where you can bring some insights. Over to next slide, Nandan. So this is now 2 years into pandemic. I don't see any more elaboration on this slide. Teams, Zoom, Meet, WebEx, Viva CRM. There are multiple tools available. You can use any of the tool depending on the preference of the KOL. And also in certain settings, I have seen that there is some restrictions from the organization also, that the organization is guiding you to use only Teams or to use only Viva CRM. So we need to balance both the preferences, but priority should be given to KOL. So if KOL is okay that I would like to do a telephonic call rather than a team meeting or a Zoom meeting, then we have to respect the suggestion or feedback of the KOL and go for a telephonic call. So I would take all the questions in the end. So would it be fine with the team, Nandan?
Yeah, sure.
Okay. Yeah, Nandan, next slide, please. So certain ground rules while you start working on virtual interactions. I know people are currently doing it, and you know more than me because you are the tech savvy millennials who are into technology, and I am from the previous generation. So, but I have learned a lot in last 2 years while working as an MSL lead, and also I worked in a strategic medical role. So virtual setting, I would say that it eases out our work also in a manner, because for meeting doctors, we need to travel, we need to get their appointments, and we need to wait for their time. This has experienced by every one of us. So now with the virtual thing in place, we can have a conducive time from the doctor as well as which suits you. And then you can sit at your office or at your home, and you can meet the doctor and get the things work for you, rather than traveling and rather than getting exhaust during the whole traveling and waiting period. So what to do before you start your meeting? Make sure you understand the platform. Platform means Zoom, Teams. So everybody now is very well acquainted with these platforms. So whosoever is new to platform, just try to work around the platform, understand the nitty-gritties of the platform, and then once you are okay and have a complete understanding, you can then move to the next step and fix up the interaction schedule with the KOL. Then you should be aware that how much time you have for the meeting, because this is very important. That I'm already mentioned that doctors have very limited time, and in that time they would like to devote it to their patients more. So we have to be very mindful of the time. I would suggest that with my experience, and I have seen in most of the interactions, until and unless you are working in a very niche therapy area or an upcoming therapy area, KOLs in that therapy area would give you time. They would give you 30 minutes to 45 minutes at a stretch. But if you are working in a very already existing therapy area, chronic disease therapy areas, their KOL would love to discuss recent updates and recent happenings. And if that is not there with us, then we should understand that we would be getting somewhere around 10 to 15 minutes max, and that is the time we need to engage the KOL with us. We should have some story behind what we are going to discuss. We should connect the dots. So if you are meeting this KOL after 3 months or after 2 months, then you should connect the past discussion with this current conversation so that there is a continuation, and you are giving him more and more information on the therapy area. And it should not be a one of the random call coming from you and doctor is saying who are you and all. So we need to connect the dots. We need to build a story around our discussion, and try to make it more and more dialogue rather than a monologue. So think about what is more attractive for the KOL. What should be thought provoking for the KOL? People do probe KOLs and doctors, but try to do it very judiciously. Don't over probe or don't under probe. If you are going to probe, then you should have specific questions in place and you get the right answers, and then only you proceed further. Because some people, some doctors may get offended also, because you are getting more and more intimate with the questions while you are asking them. Then what material I will be using for the meeting? So if you are presenting something, your deck should be completely thorough to you. You should have an updated information. You should be ready with the reference literature for the deck, and you should be ready with your communication pointers also out of that reference literature. If anything goes wrong, suppose there is a technical glitch, suppose there is a power shutdown, then you should be ready with a backup plan. So I know this backup plans work very minorly during these periods, but we should have something in a backup so that you can have a direct telephonic call instead of team meeting if something untowards happened during the call. And how will follow up the conversations? This I already touched upon, that whenever we are connecting again and again with the doctors, we should connect the dots. We should build the story around what we discussed last time and what is the agenda for today's call. So this is how we can prepare ourselves before going into the virtual meeting with the KOL. Next slide, please. Also, we should be very articulative in terms of our voice modulation. So when we are talking to a doctor, you have to understand that you are speaking to an expert, and you can't be on over pitch or under pitch tone. So you have to change your pitch according to what you are presenting or what you are communicating. So if you're stressing on something, you have to be over pitch. You have to stress on that point. Take a pause. Give some time for doctor to understand what you are saying, and then where doctor is saying that this is not clear, then you have to speak loud and you have to be more clear and bring more clarity in your pronunciation. Show confidence. So this I already this is my favorite kind of skill set. So because people working in medical affairs, they think that they know everything from the day one. But when they enter into the therapy area, they have to learn the therapy area, unlearn the past therapy areas. So there is lot of skill development happen when you moved into a different therapy area. And the confidence is something which will come with your knowledge. So if you have a complete thorough knowledge of the subject, I can assure you that your confidence would be super high. And if we are lacking on knowledge, and if we are not having those answers to the questions, then our confidence will be not very high, or it would be very low. So engagement of KOL is dependent on your knowledge domain, and then knowledge domain will bring your confidence, and that confidence will bring your voice modulation. That this is the point, sir, I would like to stress on, and this is the point where I would like to have your opinion or feedback. What is your suggestion? So all these things are like revolving around your knowledge domain or therapy understanding. Next slide, please. Also, during the meeting, we should take care of our own postures and our own body gestures to the camera. So imagine KOL is sitting in front of you and you are just ignoring him. You are looking here and there, and you are just doing distractions while KOL was speaking to you. So all these things are like annoying for the KOLs and doctors, because they thought that you are totally uninterested and wasting their time. You are just doing it for the sake of doing it. You are not giving your full commitment towards the call. So we need to be completely attentive. We need to give more time and more face face time to KOL. We should always try to look into the camera. Always turn on your camera while speaking to KOL, because speaking to a wall is not very encouraging, and it will not solve or give you an impactful call. Also, try to avoid hand movement. So I know that as a orator, as a speaker, we have learned that the more you express things through your gestures, the more it gets absorbed. But that is for in-person meetings. While you are doing it in virtual settings, I would say that try to minimize the hand movement, and try to be more vocal and more vocal through your facial expressions rather than through your hand gestures and movement. Next slide, please. Don't keep your camera too low or too high while you are moving into a interaction call virtually. And as I mentioned, multitasking is a no-no during these kind of high intensive meetings and critical meetings. So we need to follow the meeting etiquettes, and virtual meeting have their own etiquette that I have already discussed. So I hope that people out there are following it, and should follow it in future also, because this is going to stay, and we need to work now in a hybrid manner, virtual as well as in person. Next slide, Nandan. So talking about some best practices, what we are currently doing and what good MSL should do, like connect at least 10 to 15 minutes prior to the engagement call. Have a clear objective on the call. Start by building rapport that I'm so and so, I'm working in this organization, and I have spoke to you last time and we've discussed that. So that will help in building rapport, and again, recognizing of you by the KOL, storytelling methods, use right visuals, encourage dialogue, and keep time for discussion. So it is not like you have 15 minutes and 14 minutes you only speak, and then 1 minute you are asking your KOL, sir, I would now like to know your opinion. So we have to be very concise and precise, and then only the meaningful discussion would happen. Next slide, Nandu. So now my last two slides, basically these two slides are giving an introspection into the personalities of KOLs, or I would say it would be for each and every person. So there are 8 kind of personalities which has been defined by researchers, and they have categorized it under 4 colors: red, yellow, green, blue. So red, if it is red, they are more of a formal people. They are like directors. They will like to be more demanding and determined. They would like to be more purposeful, competitive. They would like you to be brief. They would like you to be very brief, concise, precise. So I would say people who are at a very national level of KOLs, high stature, egoistic KOLs who are having high ego, you should understand what needs to be customized for them. So you need to be very brief in your discussion, and they take decisions which are like pragmatic. They are, and under pressure they may dictate also. If you over probe, then they may dictate you. I think I have now no time for you. Currently I am occupied, so let's discuss it later. So that these kind of scenarios happen, and these are very common scenarios. Then we move to the sunshine yellow. These are people like inspirers who would be more engaging, and they would their primary focus would be interaction. They would like to be admired. and they may take spontaneous decisions, and they would be like enthusiastic kind of personalities, sociable, dynamic personalities, and demonstrative. They demonstrate what they want. So we need to be mindful of these four personalities. Then Earth Green is like these are the most supporting kind of personalities. They are like you to be very pleasant. They wants to be liked. They fears confrontation. So as they are supporter, they would not like to confront with you, and they will under pressure feel overburdened, and they take decision which needs to be considered. They are not taking any decision which is like spontaneous or pragmatic. Considered means it can be changed or it can be modified also. And last is our cool blue, which are like observers. So they are formal, conservative, like you to be very precise, wants to be correct, and under pressure may withdraw and take the decision that are very logical and deliberate. And they are very cautious, uh, formal. They will ask a lot of questions. So we need to get ourselves prepared as per the uh, settings and as per the personality of the doctors with whom we are engaging, and this will come with time. So in the first interaction you would not be able to work around the personality, but you can understand the personality of that KOL in one or two engage interaction calls, and then moving ahead you can customize your discussion around these important pointers. So I think with this I would conclude my talk, and I hope that there is some learning for people who have joined us in terms of how to master the art of virtual interaction and how to move into a meeting, how what all points need to be kept in mind while we are doing that virtual interactions, and what is our takeaways from the call is very important. So thank you everyone for your patience listening. And with this, I would hand it over to Nandan for further proceedings.
Thank you, Dushyant, for setting up this wonderful context and explaining how things have to be done, the basic hygiene. So now, our guest for today, Mike, we would like to know more from you. Like, we are interested to know. So this is how Indian things are done. So we would like to know how it is done in Europe and US. So with that intent, we have some questions framed up for you. So let's have them. And also, Dushyant, you can add in your points as well. So, Mike, how can a new MSL, coming into industry for the first time, or maybe a new therapeutic area per se, how can that person build up the relationship with the KOLs virtually? What are your thoughts on that?
Well, thank you, Nandan, and first of all, thank you to the Society for Field Medical Affairs for this invitation. I'm very excited to see what the activities are for the Society, and also thank you to Dushyant for that great introduction, because actually some of the things that you talked about is the gold standard that we train a lot of our field staff in field medical at Amplity Health, and that's to do with the scientific engagement model that you've laid out with the circle for planning, and also the colors. Something that color preferences is something that when you delve into it, it makes so much sense. It just feels like it is a revelatory set of skills to be able to learn, because we can often think that the style of fiery red, for example, is negative and comes with its own challenges, where you think, oh, that person's very short with me, or he only writes 2 words in an email. And you think, oh, you could become a bit offended and think, it's what have I done wrong? But actually you realize it's people's communication styles and preferences that actually are the key to connecting. I'm sure Nandan knows, as he's getting married, the communication style of his future wife and how to get the best out of the relationship. But that can happen professionally as well. And we have to start that in this environment. I think the first thing is a general, that MSLs need to be a lot more aware of their style of communication. Whereas actually, in person, we could have probably got away with a lot, and being able to be, work it out as we go along. But I think in the virtual environment and engaging, that planning and understanding communication styles is very key to be able to have an effective engagement. Now, you talk about different areas of the globe. I've had experience with interacting with people in South America, in Europe, Asia Pacific, and in Japan as well. And a lot can come down to culture and context of the local situation, because some cultures pre-pandemic were very face-to-face driven and what we call high context cultures. They needed a lot of information. Everything is about understanding the information. And other cultures actually, they're a bit more relaxed about whether it's remote or or face-to-face interaction. And we found that a lot of people, especially in cultures where face-to-face was the key, that norm, that first respect, as Dushyant was talking about, actually knowing, right, you're going in to meet with a very experienced KOL, how do I conduct myself and how to not make a fool on the first impression? Because as we know, how long it takes within a few seconds, 30 seconds, for someone to have a judgment on an impression. And so where there has been a lot of cultures that were face-to-face, we see that it has been a real shift to go virtual and to have a different mindset of working. Now, going specifically to your question about a new person or a person going into a new therapeutic area, that really comes down to that planning of research. I think you have to understand that the background of the KOL, of public information as much as possible. What have they published? What have they been able to influence in the field? What is their status? What research groups are they part of? Because you may be going into someone who's very focused on clinical research, somebody who's academic, someone who's actually just a regular prescriber. You really have to understand the context of what you're going into. I would say that for face-to-face or virtual, but because understanding, as Dushyant mentioned, that knowledge base, have it, you are the one, you may be not the expert in the disease, and that's fine. Just relax about that. It's okay. You're not going to be the professor in hematology on day one when you have to put your context of your compound in front of them to talk about, or the development pathway. The idea is that you would become the expert in the molecule that you're dealing with, and maybe the patient pathway of how, for the right patients that molecule will go into, and also the scientific on that rationale from where you see the unmet need for that patient. So I think it's instantly relaxing and saying you're not going to be an expert on day one. So what is it you're going to bring to the table? And so I think it's you've mentioned that planning, but also it's understanding the KOL, what is available that you can research for them, and also understanding how to get to speak with them. So if it's the first time, we talk about the gatekeeper. And sometimes there is a gatekeeper, there is a secretary that you need to get hold of. You need to build a relationship first before you even get in the door. Or that actually, if they have such a busy clinic, it may be another professional within the department, so a nurse or a lab technician. It really depends on how the setup is within that department, and you may need to go through that gatekeeper to get an appointment. Now, say you are successful in getting an appointment and you've managed to get past that stage, then it's then definitely about showing that balance between the information of what you've researched, and not feeling like the person is, wow, okay, you know everything about me before I've even started. You need to be natural. You need to show that skills, and part of the skills that I think MSLs need even more so these days is self-awareness, and how because that self-awareness is having that way to start that flex of that dialogue when they enter into the interaction. And then it's understanding the color preference as you're opening out the conversation. Open questions, that is a key in remote interactions, is having to ask open questions, because the why, the how, the what, these the 5 W's, we call them, you need to be able to ask those open questions, because if you ask those open questions in a face-to-face setting, you know, the conversation may develop naturally and evolve, and you may be able to have it navigate in different ways, but there's less cues when you start an interaction. So appropriate open questions, I would say, is a great opener to maybe pop open the bottle cap to kind of get those further minutes, like, you know, just moving from 5 minutes to 10 minutes, maybe stretching out to 30, depending on how you're able to ask those questions. So I've talked a lot. I don't know if that is enough for now. If we have any other questions, Nandan, or I'm happy to elaborate further as needed.
Perfect. The importance of pre-call planning, you know, for the newcomers, it's really important that you have highlighted there. So let's take one question from the chat function. Maybe Dushyant, if you can answer this. If the doctor is not willing to discuss their patient challenges with MSL, how to proceed?
So basically, if doctor is having those closed approach for us, that he is not very keen to discuss, and he is very having reservations against discussing his patient challenges or need gaps in the therapy area. So my suggestion would be that we need to again go back in the beginning of circle and find out how is this KOL. What is the likes and dislikes of this KOL? So you need to, as Michael said, that we need to do a complete profiling of this particular KOL. That where is this KOL having some interest in? And then we need to start from the interest area of the KOL. So it should not be always that we go with our own agendas and we get the things done. If doctor is not answering, then just go to the next doctor. Why doctor is not answering? We need to find out that the doctor is more interested in talking about some patient support program for his patient. If you can just bridge that gap, if you give that particular service to the doctor, then definitely with more and more interactions, you will get to have the answers to your questions. So I would say customize your approach and customize it as per the interest and as per the need of the KOL, rather than going with your own agendas and getting responses to your already decided question. So we need to have a customized approach for each and every KOL that we interact with. I would like to have comments from Michael also on this.
Dushyant, you opened out in a great way. I would agree with what you've said in those areas, that profiling, that preference, and just to develop a bit further and say a practical example would be finding out what recent papers they may have published, if they have any published paper, and actually have your next call as starting with that and saying, well, I've just seen in the Journal of Gastroenterology that you are a co-author on, you know, maybe profiling a new diagnostic tool for your patients. Can you tell me a little bit about that? It's exactly as you said, finding that common interest, because I think some MSLs may feel that pressure, oh, I've got to get through my tick list. They may have a set number of interactions that they need to do in a specific month, you know, depending on the outlook of the metrics. And they might be thinking, oh, how can I report if I haven't got the valuable information? And thinking that I've got to get through my one liner. Oh, I should have talked about mechanism of action and I didn't quite get there. So was it valuable? I think we need to be more flexible and understand that this is a long-term game. And it's also one eye on thinking, actually, I'm here to build relationship and rapport. And if it's just about what you need to deliver, you know, that's not a real relationship. And I think you need to always have that, as you said, that two-way part, which is the skill of the MSL to know how to crack the nut, how to get that bit, the next bit, by using specific topics like we said about publishing, but it also might be, as you said, about compassionate use, asking about their specific patients, and also maybe finding out their other interests. Maybe they want to talk about collaborations for basic research or some other, you know, mental health even, you know, what we find sometimes with the therapeutic areas, is that their interest lies totally outside maybe the normal way of working. And we need to be sensitive to that when we approach a KOL.
Perfect, perfect. Very interesting discussion. So let's move next gear. What challenge that we are facing here is digital fatigue, Zoom fatigue, or whatever terminology that we use. So how do we overcome that? Mike, do you have any ideas of that? Because what we are hearing from KOLs is like, we are done with virtual conferences, we are done with virtual meetings, and they are willing to only have face-to-face. So how do you tackle such situations? Any thoughts on that?
Yeah, I think a little bit. I mean, it's real. Microsoft did a study where they showed brain temperature increase and lack of concentration change over back-to-back Zooms and how that affects health. So it is a very real activity. I think it's understanding your value and what you bring to the table, and if you're able to articulate that value back to the real point of why are you contacting, and people professionals that may have a lot of Zoom calls, they will even make time, because if it's valuable to them, if it's a point where they can connect, then I think people still do that. I would also work with a KOL and say, look, I really want to have this interaction with you. Are there better days that you having less Zooms? Let's try and meet there and have a connection point there. If it's be able to plan ahead with, are they going and attending conferences, even virtually? And you can base your topic around then. So maybe if it's a dry time, as maybe Dushan said, in terms of being able to give anything new, move your appointment to the back of a congress that is maybe regional or international, and insert your time in them. So yes, they may have had Zoom fatigue, but their mind has been buzzing with new information. Their mind has been buzzing maybe with interactions with their own peer-to-peer level interactions. So I think it's also being wise at the timing of the call. Dushyant, I don't know.
I would concur. I would concur with you, Michael, because the call timing is something which is very relevant in today's settings. So there was research which showed that most of the clinicians and practitioners, they would like to interact on weekdays between 2 to 5 and then post 8 p.m. So this is the most preferred time by all the practitioners in that research. And also, if it is weekend, they would like to engage post 8 p.m. only, not before that. So we need to be cognizant of this timings also. So if you are reaching out to them at right time, and yes, as Michael said, bring some innovations to the table rather than being very monotonous and being very predictable. You should come with some innovative kind of topics or innovative kind of presentations. Or you can also, one suggestion I would give, that since Michael touched upon conferences, so if you can just give them download of recent conferences which they may not be able to attend, then that could be an interest factor for the doctor, and they will definitely like to know more about these kind of recent conferences. So this is one of the examples to bring innovation in your interaction.
Perfect.
Yeah, Nandan.
Yeah. So Dushyant, like we can have an Indian scenario question for you here from the chat function. So if we are getting only 5 minutes in the chamber, how to have that constructive talk? Because we come across many such scenarios. So how to deal with it?
So I think this question is very important, and I have seen myself that in many of the cases where we thought of having 10 minutes with the KOL, but at the time of meeting, KOL came up with his own reservations that I have only 5 minutes, and you need to then improvise at that particular moment of time. So my suggestion during those 5 minutes, just stick to your, if doctor is interested, then stick to your already decided or already mapped questions which are based on your strategy. And if you think that 5 minutes are not something which is going to serve the purpose, so if I would be you, I would request doctor that sir, can we reschedule it and we can do it in a later day or in coming days, because I would respect your time and your priorities. So let's connect again. So there are two aspects to it. First is, if you are interested and if you don't want to wait for next meeting, ask your questions, and if you are able to get it, nothing better than that. But if you are not getting those kind of responses and doctor is somehow jittery or very cranky, then you just reschedule the call and do it in a more conducive manner, where time is there and doctor is more comfortable while speaking to you. Michael, any further point to this? I hope how you are managing these kind of challenges.
Yeah, I think you had to, I agree with getting to the key point, keeping one key point. And I think MSLs feel that because they've been given maybe multiple kits and kicks, to maybe ask along the way, they think I have to ask everything because otherwise I'm not doing a good job. What will my manager say if I had this interaction? Oh, he's a big guy, a big fish, and I didn't get 15 minutes. I only got 5 in the end. I think we have to just allow for that, and it's people. At the end of the day, he may have had a terrible day and very difficult interaction with a previous patient, and he's giving you extra 5 minutes. Otherwise, he would have cancelled the call. I mean, that would have been the other way. We also looked about what we might have had, which would have been oh, I'm sorry, I can't do that today, and that's it. But he's still giving 5 minutes, and I think we can balance it with the key point. And then, as you said, Dishant, earlier in your talk, we're supposed to be a scientific buddy. And if you're a good buddy, you have allowances for these things, and you flex your situation, and you add another appointment where if there is a lengthier discussion you want to have, not just a general one, but a lengthy one about a specific topic which needs that amount of time, you're being respectful to them and saying, I really value your input. But I would appreciate more time to discuss, because I know this will be a benefit for you. So it's also then selling the the value of what you're going to talk about as well. So those 3 parts would be my addition to Dishant's great description.
This is really exciting to hear, experts telling what's the best practice and how to go about. So we are coming across this terminology called omnichannel, and it's a buzzword right now. So how, Mike, what's your take and how to go about omnichannel as a communication tool for the medical affairs?
Yeah, in a way, omnichannel I feel is in some ways a bit of a derogatory description for MSLs, because MSLs are flexible. They're able to talk about different channels anyway. I mean, to be innovative and to have a skill set, we've been having to learn digital, we've been having to learn different platforms. So I feel that actually, MSLs were flexing to a lot of this anyway. I think where it is become more of a challenge is we all live in a information overload age. And we always get, we all know that we can sit on a weekend and watch 10 hours of Netflix and not remember what we watched. How do you make that impression to have across towards the KOL? So I think it is using things for the appropriate time and able to, yes, skill yourself up 100%. We have moved on in an age where we need to think about digital a lot. We need to think about social media. We need to think about different types of platforms for engaging, not just the one way of the face-to-face. But I feel that as maybe millennials or Dishant, you have great skin because you don't seem that old. So you have a good skincare routine. But I feel that we have, as MSLs now, need to be able to be flexible and be able to upgrade our communication skills, especially to take the cues in different ways and flex to the right situation. That is it, not being stuck in one way of working, but think, okay, really, what is the best way to communicate? And that specifically around just not, I would say, not necessarily using digital for the sake of it, because I think that's a tick box. Yeah, digital will work if we flick to that. It's the right style. I mean, would a video presentation help the KOL, which explains the mode of action, or is it a slide deck that can help them pictorially, or is it just a conversation of you explaining it? These things that you might think, oh, we have to go digital now for everything, but I feel that some people just use it because it is possibly the new way of doing it. But you find that as humans, we have different drivers, we have different preferences, and I think it's being smart about it.
Exactly, Mike. So you've touched upon their hybrid mode of working, right? So that should be something that we should target, not entirely digital, not entirely face-to-face. So we have to have a right balance of virtual and in-person engagement. So yeah. So another interesting topic that keeps coming is digital opinion leaders. Okay, so you have key opinion leaders. So what's digital opinion leaders here? And can we leverage on that?
Yeah, I'm happy to carry on that, and then Dushyant can come in afterwards. I mean, what I feel is that actually we have to be careful. We have seen along the way in the media scandals around people have set up social media campaigns, Fire Festival. I don't know if you've ever watched any of that, but you watch that and you see how digital influencers create this picturesque world. And then when it comes to the physical, it all falls apart. And I think we have to think, well, if we're reaching out to digital leaders, we have to check firstly their credentials. Are they guideline authors? Are they actually doing things in the field? Or is it people that want to bring themselves to a specific status, when actually for your strategy, for your engagement, and also for what the output is, you could be going down a rabbit hole, and you could be not getting the what you also need out of it. So I think it's being careful to find out, spend time investing it with digital opinion leaders. But I think where you have people that have credence, they have a track record of scientific influence, where they maybe have record of speaking, or they as I said, are guideline authors or something, can influence at some stage the treatment paradigm. Is it just that they're coming to a new level and know they need to engage through social media, and actually their profile is being raised digitally? So you would have them as a KOL anyway, regardless of whether they had a strong digital presence. And I think that's something for us to think about. But with the designation, what's great is this technology is coming forward to help medical affairs to track digital interactions, digital presence. So actually, I think this will be a component of the future in how to really understand how messages are going out, how professionals are interacting, because, especially in conferences now, are we actually going more digital in how we receive our information, how we get our influencers interacting with medical professionals and then peer-to-peer. So it is an important topic, I think, needs further exploring.
Agreed, Michael, with you that yes, there are pros and cons of every thing that we use. So I think digital opinion leader, in my what I see it as, they were already there, but previous to pandemic, we were not giving them that kind of importance, or we are not following them, or people were not their social circle or their influence circle is not giving them that kind of importance. But since this pandemic has changed everything in terms of engagement and how they influence their peers, so now digital opinion leaders are good to have in your kitty. But one disclaimer to this would be that we need to choose very judiciously that these people are therapy advocates and have good credentials, as Michael said. And these people also have some social presence where people are following them and people are getting influenced by their uh, clinical practice behaviors and patterns. So digital opinion leader, yes, it should be a good thing to have, but not a must thing to have. If your KOLs are there, you can very well, if you have a good connect with them, yes, the therapy shaping activities would help you to bridge the unmet need in the therapy.
Thank you. So I guess we are shorting of time. Is it okay if we can have one more question? That's one last question, panelists, if that's okay.
Yeah, Nandan, yes.
Sure, of course.
Okay. So here, the last question is really interesting. You know, how to differentiate from insight and just a normal interaction information that we receive. So the way he has put it is really interesting. How to find the magic nugget called insight. So either one of you can take it up.
So I think let me start. So this is an important and very relevant question because most of us have experienced this that while we discuss it with the KOLs and when we are going into meeting them face to face, there are certain things in our mind and we have our own specific key points that we need to discuss. So answer to your questions would be only data. Okay, answer to your questions would be only data, but when you are having your strategic imperative in your mind, so we all work on some strategy. So pharma world is basically strategic oriented. So you have some strategy for your therapy area or for the molecule, and you work around those strategies to have some tactical plan and then move into the execution. So if your question is based on some strategic imperative or strategic questions you are asking and you are getting some responses from KOL, then that could be converted into insights. And how to convert into insights, it's my experience. You can have your own ways of generating insights. I used to validate the responses. So if I am speaking to 10 KOLs, and from first KOL, I got to know that this is what is happening in the therapy area, and this can change the strategy. Then I will validate it with the rest of the 9 KOLs. Whether, sir, you are also doing these kind of things, or whether you are practicing in a same manner, or this molecule is beneficial, or the safety profile of that way. So it is around multiple things. But to convert data into insights, you have to have a strategy in mind and you need to validate it with the a group of KOLs, and then you can present it to your cross-functional team. And if they are aligned, then that strategy can build into the plan. So this is what I used to do, and I try to get it from the team also. Yeah, Michael.
Yeah, thank you, Dishan. I like that process foundation that you've laid out there. It's starting to then move into the distinction of, with that data or that information, of why. What is the point of collecting it? And I think that's where it then can turn into an insight. Is it actionable? Can you do anything with that? Is it just knowing that 10 patients had this safety event, for example, or was it specifically to do with a difficulty with an injectable, something like that? What does that information mean? Is it going to change your company strategy in any way? Is it going to make it focusing on a specific area? What is it going to disrupt? What is that information going to change? So it's then how it's used. It's the why of taking that. If it says, well, if you know that, for example, that there is a key safety event for the class, and you want that, you're looking out for that information, then you understand, okay, yes, I need to uncover that, and the process of uncover that. And I'm fortunate to be part of an organization in Amplitude Health that provides a lot of this training for the MSLs, because it's a skill. to be able to just report information. And we've seen it that in the beginning, you might think, oh, it's, this is an insight. And then your manager comes along and says, nice, but it's just information. You have to think a bit bigger and saying, if I take this in, are they going to sit there and go, that's nice information, but okay, now I need to have a meeting with the therapy area head and say, check our strategy, or do we need to change our medical communication plan to see what we're doing? So how is it going to then be taken and viewed? So I think it's that whole conduit, quality in, quality out. So I think that comes to that all together with the process as you've talked about, Dushyant. So thanks for describing that.
Perfect. So there's some food of thought for all of us here, and it's really surprising that we are past 1 hour and it doesn't feel like that. It's really interesting, the discussion that's been happening. So thank you everyone for attending and for your valuable questions, and also to our panelists for today, Dushyant and Michael. You've been really humorous, and the way you have delivered it, it's bang on. So thank you, and it's all pleasure to hear you, both of you. And just a remark that SFM has been doing such activities, and we are continue to have this presence to encourage and learn all the field medical associates or medical affairs associates within India to grow. And we'll stay tuned to this page, SFM, and we'll keep doing such activities, which is interesting and also education. Thank you all, and have a good day. Good night.
Thanks, Nandan, and thanks to all, and wishing you all a happy learning.
Thank you, Nandan, and everyone joining the call. It's been a great time to be together.
Thanks, Michael.
Thanks, Dushyant.